Have you ever heard of blood flow restriction training? If you haven't, you may want to stick around to find out what it is. I'm Dr. Ryan, physical therapist, and I help clients get over knee pain and get back to the activities they love. BFR, or blood flow restriction training, is something that I use very frequently with my clients to help them achieve this goal. So you're probably wondering at this point, what is it? Blood flow restriction training is a method in which we use a specialized tourniquet wrapped around the limb to partially occlude blood going into the leg and fully occlude blood leaving the leg. This may sound a little crazy at first, but we actually use specialized technology that helps dial this in to each person to make sure that we're doing a very good job of personalizing it to you and we're not fully occluding your leg of blood. There, we then do exercises with the client under partial occlusion, which creates an environment of fatigue around the muscle, tricking it into thinking it's further along in that process than it actually is. So why would we want to do this? Why put a tourniquet around someone's leg and go through resistance exercises, which obviously can be uncomfortable? BFR is actually a game changer for people that are having knee pain and can't tolerate regularly loading their leg. With blood flow restriction training, you can make progress with as little as 50 to 80% less weight compared to lifting heavier loads. So in terms of 1 rep max percentages, a 1 rep max is how much weight you can push one time for a specific lift. So for example, if you can lift 100 pounds during a squat and that's as much as you can do, with blood flow restriction training, you can make muscle improvements doing just 20-pound squats while under occlusion in that scenario, and up to 40-pound squats. So it really allows us to reduce the amount of load going through a joint that is either painful, has arthritis, or has some other injury that's not allowing that person to exercise for whatever reason that may be. You might be asking, how does this actually work? How does this make changes in your body? By restricting the amount of blood going into the leg and all of the blood from leaving the leg when we're doing weightlifting exercises, it essentially creates an environment around the muscle cell that tricks it into thinking it's much further along in the strengthening process. So what's happening is there's less oxygen and nutrients available to that muscle cell, because as we do repetitions of that exercise, normally that blood would leave that leg or that limb that is being occluded, and new nutrients would come in, which allows us to exercise for longer periods of time. A little bit simpler level happens is it just creates a whole bunch of fatigue for that muscle, so it's working a lot harder. So there's less pressure going on in that joint, and the muscles are working as if they were lifting heavier because of all of those changes that have occurred. Now, this is not a magical device. You still have to work hard when doing blood flow restriction training. You still have to put in a lot of effort, and it can actually be a little bit uncomfortable, and some even say painful. Your quadricep and thigh muscles tend to get very tired very fast, and pushing through that requires a lot of willpower to be able to do it. But the nice part is, typically these people are not having pain in their actual knee while they're doing the exercise. So it's much more tolerable than dealing with that everyday pain that they're used to. One area very effective with my clients is people that have knee pain due to arthritis, meniscus issues, or tendonitis, and just can't tolerate loading their knee. We find a lot of these folks do really well using blood flow restriction training because they're able to exercise that limb and get stronger over time and reduce the amount of load going through that arthritic knee or through that tendon that has tendinopathy.